can either do it online or through *147#. And after registering, you need to present yourself at a Huduma Center or a social health authority agent to have your biometric data taken. With all of that, you'll then be issued with a social health insurance number so that you're now a member. What is important to remember is that the Act that was passed says that every Kenyan must be a member of the Social Health Insurance Fund, and contributions will be made on their behalf. So that means that from the point of birth, a child must be registered with the Social Health Authority. So how do the regulations deal with this? The regulations say that within 14 days of the birth of a child, that child must be registered with Social Health Authority. And this will be done with the birth notification. So if it's a child who has just been born and it's within the 14 days, a birth notification can be used. If the child is over 6 months, then the Social Health Authority would require a birth certificate. And this is just because it is recognized that it can sometimes take time to get a birth certificate, and most people may not have it within those 14 days after the birth of their child. So for those 14 days, the birth notification will be enough. When that child is registered, it's, as a dependent of the member, they will then get the minor social health insurance number. And this is, again, just to distinguish between the member's insurance number and that one of a child who is still getting treatment under someone else's cover. Once that child gets to 18, then they'll now be able to update the details and be deemed as a separate household from their parent or guardian. And they'll now be eligible to contribute. The biometrics of a child will only be taken after they're 7 years old. And this is because, again, we recognize that especially for fingerprints, it can be challenging to take for a child under 7 because they're still having changes to their fingerprint. So once they've been permanently fixed, and usually that is confirmed after the age of 7, then they can have their biometrics taken. Once the child is 18, as I said, they'll be treated as a contributor on their own right. However, if they're over the age of 18 and they're still wholly dependent on their parent or guardian, and they living with that parent or guardian, then they can still get cover under that parent or guardian's cover. So it doesn't mean that the moment a child turns 18, they automatically have to find to contribute. They're dependent on their parent or guardian. And that applies until that child is 21 years old. So from 18 to 21, if they're dependent on their guardian and they have no source of income and they're living with that guardian, they will be able to benefit under the cover of their parent. If they are in full-time education and have the proof of enrollment in full-time education, for example, in college, or maybe they're still not finished high school, then again, they'll be able to benefit up to the age of 25. So you can see that for the social health insurance, there's allowances made for the children who are still completely dependent on their parents up to the age of 21, and then up to the age of 25 if they're in full-time education. For a spouse, you'll need the ID of the spouse and proof of marriage. So again, here the law recognizes that not everyone has registered their marriage, so they can either use the marriage certificate or another document such as the affidavit that shows proof of marriage to register your spouse. Again, for adopted children, an adoption order is required. For a child for whom the contributor is a guardian, then a will, a deed, or a court order will be needed. In addition, because there are children who are living, for example, in children's homes and such institutions which are governed by the Children's Act, the Social Health Authority will also recognize documents under the Children's Act for purposes of showing that this contribution is being made on behalf of a child who's maybe under guardianship. For persons with disability, you'll need the ID, the certificate of registration with the National Council for Persons Living with Disabilities. And this is again because under the Social Health Authority, persons living with disability who are completely dependent on a contributor are able to benefit for their entire lives under that contributor as a person living with disability. So they need to just prove that, then they'll be able to benefit under the cover of the guard. For persons in prison, I remember I mentioned that the law says that the government must pay for them. So to register them, they'll need the prison admission number or the remand identification number if they're in remand. For children who are in conflict with the law, that is children who are in children's remand homes or rehabilitation institutions, they'll just need the admission number to those institutions or to that remand home, or the child's birth certificate to register. Now, one important amendment that was done recently to the regulations to make it to speed up the registration process is that as of 19th of September, all members of NHIF have their data transferred to Social Health Authority upon verification. So what this means for the member who was a NHIF member is that what they need to do is to still go through the registration process just to check that the data is up to date and fill in the additional data that Social Health Authority requires to complete the registration. So it doesn't mean that the data was, once the data is transferred, registration is complete. It's still important for the member to go through, make sure the data is accurate, and also fill in the additional parts of the application form that Social Health Authority requires. For amendment of beneficiaries, so if I want to change the people who are benefiting from my cover, if maybe I want to add a spouse, then I'll need the new spouse's ID or proof of marriage. If my current spouse has passed away, I'll need the death certificate. Then I'll be able to make the change. If it's divorce, then I'll need a divorce decree. If I want to add children to my cover, I'll need either the birth certificate, just as before, or for an adopted child, the adoption order, or if I'm a guardian to a child, then the will, the deed or the court order, or a similar document recognized under the Children's Act. To deregister, it will only happen in one situation where the beneficiary dies. So if someone passes away, then the authority will be notified by the principal registrar of births and deaths that the household of that beneficiary has changed, and that person will then be removed from the Social Health Authority. But what is important here is that for those who paid upfront, for example, the self-employed or the non-salaried, they pay upfront 12 months in advance. If that person passes away before the cover period has ended, then the beneficiaries under their cover will still be able to benefit. So that means if, for example, I had paid from January to December, and then by misfortune I pass away in February, the family under my cover would still benefit until December. So I'll then go to contributions. The Act requires, as I said, that those all Kenyans must contribute based on means testing, which determines those who can contribute on their own behalf and those who will need assistance from the government to make contributions. So for the self-employed, and I'm sure most of you will be interested in this section, for the employed, that is the people who are in employment, their contributions are deducted from their payslip, just like it was with NHIF, and it must be paid by the 9th of each month. So if it's not paid by the 9th, then the penalty will start to be charged, and the penalty for Social Health Authority is 2% of the late contribution, or the contribution that has not been paid. The actual contribution amount, that is how much the member will be paying, or the contributor, is 2.75% of their gross income. So not the basic income, not the net income, but their gross income, 2.75%, and they'll be paying it monthly. For the persons who are non-salaried, it's also 2.75%, but the difference is that they are paying annually. So they pay at the beginning of the year, or whether it's for 12 months, and they must make the payment before the lapse of that contribution period. So if I want to pay for 2025, I must have paid my contribution by middle of December 2024. So for it to be recognized, and so I don't get late. Also, for those who need a financial assistance because the means testing has found that they are not able to pay for themselves, then the national and county governments will make the payment annually as well, within 9 days from the date of the annual contribution was due. The same will apply for those who are in prison or other forms of lawful custody. The payment will be made within those 9 days from the date the contribution is due. So I mentioned means testing. I'll just talk about it briefly. It applies mostly to those who are not in employment and those who need financial assistance, because for them, the government needs to know how much they're earning so that it can assess their contribution rate and also whether they need assistance. So it's based on a tool that has been developed by the Ministry of Health and the Ministry in charge of social protection, as well as the counties. And they collect data on the social economic aspects of a household and use those different data to decide or determine how much this household will be able to pay. The important thing is that the means testing will not be just been done once, because I know that's the question that comes up for members. What happens if, for example, I was self-employed, then my business closes down, or I was a farmer and then I lose my farm, or I'm unable, or my harvest fails? So the means testing will be done periodically, so that if it's found that you later need assistance in making contribution, that will be identified through that tool. The final fund that I want to talk about, I've talked about primary healthcare, social health, and now the last one is the emergency, chronic, and critical illness fund. So there are two types of people who will be accessing this fund. The first group of people are those who are social health insurance fund beneficiaries who have registered and paid contributions, but they exhausted their contributions under the social health insurance fund. Those ones will be able to access chronic and critical care, continue to access that care under this fund, the Emergency, Chronic, and Critical Illness Fund. The second group of people are persons who have an emergency. Any person in Kenya who has an emergency under the law has a right to emergency care. And so under this fund, they'll be able to access that care. So I've already mentioned the type of benefits, or rather the level of benefits. For primary healthcare, it's level 2 and 3. For social health insurance, it's 4, 5, and 6. And emergency care will be from any licensed and certified healthcare provider. Now, the benefits themselves, that is what the member can get from a healthcare provider, will be chosen by what is called a Benefits and Tariffs Advisory Panel under the regulations. So this panel will be, once it's in place, will be reviewing the benefit every 2 years and making changes either to the prices that the authority will be paying or to the actual scope of the benefits themselves. So I think there'll be a presentation later, if I'm not wrong, on the benefits, but I'll just go briefly through what the regulations identify as the benefits for social health authority to provide to members. First is outpatient care, then inpatient care, then there's maternity and newborn healthcare services, then the surgical healthcare services, dialysis services, radiology, that is a test like ultrasound, CT scan, and MRI scans. Then the mental and behavioral health care services, palliative services, oncology healthcare services, overseas treatment for that treatment that's not available in Kenya. There's also dental and oral services, ophthalmic, that is eye care services, ear health services, screening, rehabilitation, assistive devices like wheelchairs and crutches, and also last expense, that is the mortuary fees, mental mortuary fees. So how much the authority will pay has already been gazetted. That was on 20th of September. So that notice set out what the scope of service will be. That is what type of treatment will be provided by the hospitals, where that treatment will be accessed. That is the facilities between level 2 and level 6, depending on the type of service, how much will be paid, and also the access conditions. So what do I mean by access conditions? It means that, for example, if you need to access primary healthcare service under the primary healthcare fund, on registration, your geographic details will be taken down, and that will be used to map you to a primary healthcare network. Once you're on that primary healthcare network, you can then access the outpatient services. One final thing I want to talk about, just to wrap up the presentation, is pre-authorization. So for some specialized services, the care needs to be pre-authorized by the Social Health Authority. Now, one big difference with the NHIF is that now the law has said that pre-authorization must be done within 72 hours. So within 72 hours, a pre-authorization request must have been reviewed and a decision taken whether to approve, to reject, or to return for further information. And what is created in the Act is a claims management office, which will be handling these pre-authorizations and will be able to do peer review when determining the pre-authorization. So that is the main substance of the NHIF, the Social Health Insurance Fund, the Primary Healthcare Fund, and the Emergency, Critical and Chronic Illness Fund, and how the Social Health Authority will be managing those funds. The last thing is just to say that for treatment outside of Kenya, this is only for treatment that is not available in Kenya. So the healthcare providers will be contracted by the Social Health Authority. Once it's determined that the treatment is not available in Kenya and the beneficiary has made the request to the authority, they will be able to consider that treatment and allow the beneficiary to access that treatment outside of Kenya. So with that, I've come to the end of the presentation. There's a lot more, of course, in the regulations in a lot of detail, but these are the main points. And of course, if there's anything that members feel has been left out or they need more clarification, once we get to the question and answer session at the end of the presentations, I'll be happy to clarify or to make any additions that are required. Thank you very much for listening. I now hand it back to you, to the facilitator of the meeting.
Thank you, Nyarango, for that presentation. Members, please hold on to your questions up to the end. We will have a plenary session. I can see questions already coming in through the portal. That is okay. They'll be tackled at the end of the presentations. Allow me to invite Mr. Otieno to take us through the benefit package. Mr. Otieno, please.
Thank you. Let me share my screen. I hope my screen is visible.
Yes, it is.
Okay, thank you. So I'll take you through the benefit package for SHA, the one that is currently being implemented. And just an overview is that we initially, NHIF used to run two schemes. We had mainly the national scheme that was called the UHC, or the super cover. And then we also had managed schemes. So basically, managed schemes were schemes like civil servant scheme, and then now we also had the police at some point, and then other county governments, KEMRI or DPP scheme and the like. And those are schemes that used to, on top of paying for the normal contributions under NHIF, they also used to do away with their medical allowance. And then at the same time, the government used to top up for them to be able to get extra benefits. Now for the national scheme, it was a benefit package for the people who contributed normally into the scheme. And that's why there was some variation in terms of some people are complaining they don't get particular services, and yet some were getting it. If you look at the hospital contracting under NHIF, it used to be two types of contracts. So we had comprehensive contracts and then non-comprehensive. So comprehensive were mostly government and faith-based hospitals, whereby you used to go there, get your surgical services, get your other services like oncology and the like. And then NHIF was able to reimburse almost the entire bill, apart from a few cases. And then there are these other private hospitals like now the Aga Khan and the rest, where when you used to go there, then some surgical packages were not being covered, mainly the specialized ones, like the heart surgeries and the like were the ones which were being funded for. But if you needed like a major surgery and the like, then you had to go to a comprehensive. Now what SHA has done is it's come up with one tariff, and this one tariff is either per household or per beneficiary, and you're entitled to it whether you go to each and every facility. So if you walk into Aga Khan today, then you're going in for a delivery, then the tariff for the delivery applies whether you go to Aga Khan, whether you go to KNH, whether you go to a mission hospital. The tariff will be the same for each and every beneficiary. So I think that's a good preamble as we now go into the benefit package. I'll go into the process that led into the making of the benefit package, and just to make it clear that stakeholders were involved in all the stages. And for stakeholders here, we mean members, we mean healthcare providers, we mean associations for health, we mean human rights groups and the like. So the process starts with identifying the services that can be included in the benefit package. So when you're starting, you look at almost everything. So you're looking at all benefits that possibly can be enjoyed by beneficiaries. So at this point, you don't exclude anything. Then once you do that, then now you look at the cost of the benefit package in totality, which the initial one was coming to around 700 billion, which was around the total healthcare costs in the country. So once you do that, then you get data on the population in need, because the only way you know how much the cost of healthcare is going to be is by knowing, for example, how many people will require delivery in a year. And right now, for example, for delivery, we are looking at around 1.2 million deliveries every year. That is across the country. So, and then once you do that, for example, for delivery, then you also have to see what is the rate of normal delivery versus cesarean sections, because that also determines the cost of the delivery itself. And then once you do that, then of course, now you compute the total intervention costs, and then you look at the budget impact. So this happened. Initially, we had a package of around 166 billion for SHIF, and then 107 billion for ECCIF, and then around 61 billion for primary healthcare. And then now after the finance bill was shelved, we had to look at optimizing the benefit package to match the yield that we have. The yield now is the amount of money available currently. And for that, we realize now we have to work with 2 billion for ECCIF, and then around 4.1 billion for primary healthcare, and then around 100 billion for SHIF. So that meant we had to prioritize the benefit package that we had initially, and then optimize it to fit what the amount of money we have, because there's no need of having a benefit package that is appealing to the eye, but when it gets to reimbursing for claims, you're not able to sustain that particular benefit package. Then now hospitals won't be able to sustain themselves. So after optimization, then now validation took place of the benefit package, and then now that led to the rollout of and implementation of the benefit package under SHA. So in terms of the funds, we have 3 main funds. Actually, has mentioned them. So for benefit purposes, it's clear to know that primary healthcare fund and then the emergency, critical, and chronic illness fund are both funded by the government exchequer. And then for the social health insurance fund is what is more of the same structure as what used to be under NHIF. And this is where you can only access services when you have paid for premiums. For primary healthcare, you only need to have been registered. Even if you have not paid up, then you'll be able to still get the benefits under outpatient services, that is for the basic. For emergency, chronic, and critical, it's divided into 2 in terms of access. For emergency service and ambulance service, you'll be able to get service whether you are registered or not, because we appreciate emergency doesn't give an alarm. So when it happens, of course, we don't expect someone to go through a registration before they are treated. So for emergency and ambulance services, you'll be able to access them whether you are registered or not. For critical illness and chronic illness, the fund, you can only access it when you're a paid up SHIF member, because the benefits are expected to kick in once your benefits for SHIF have been exhausted. And then now the government tops up for the difference. So I'll move into the primary healthcare fund. So the benefits under it are outpatient, inpatient, screening, and then optical services. So we look at them individually. So the outpatient, mainly it covers for acute and chronic conditions. So this includes consultation, lab services, prescription medication, vaccination, outpatient procedures, management of mental health conditions, health wellness and counseling, antenatal care and postnatal care services. For this point, it's important to note that all antenatal care and postnatal care will be benefits awarded through the level 2 and 3 facilities that is under the outpatient care. And the reimbursement is proposed to be a capitation at 900 per beneficiary per annum, though the proposal is to have it done through a PCN network. And that means you'll be, as you register, you're allocated a PCN. And now, once you have your benefits, then it means you can access services in any of the hospitals within your PCN, as long as they're level 2 and 3. And then once you access services there, then by the end of the month, SHA will have a way of reimbursing these facilities. The diseases are already evaluated, and this will be determined on how payments are going to be done. We are also privy that there's the areas where there are no level 2s and 3s close by. So you find for this particular beneficiary, the closest hospital to them is a level 4, and there is no level 2 or 3 around that place. Then at this point, we are saying these level 4s will be considered for offering of the outpatient care, because we also don't want someone to travel for so long just to go and access outpatient care, yet the reason behind it is to increase access to healthcare and commodities. So optical services, these will be offered to beneficiaries below 18 years of age, and will also be accessed across level 2 to 4 facilities, and it will cover for eye health education, eye test, and treatment of refractive errors through provision of eyeglasses. And then we'll also have a benefit package of inpatient, and this will cover management of diseases while admitted, consultation, bed charges, nursing charges, radiology examinations, drugs and post-discharge medication, physiotherapy, and then also administration of blood and blood products. The PHC, the inpatient benefit package the scope will be the same across the board, either in level 3, 4, 5, 6. The only difference is now this one under primary healthcare is government exchequer funded. And then the only difference will come mainly on the per diem reimbursement rates. So for the per diem for level 3 will be 2,240 with a limit of 180 days per household for admission. Screening services, this is one of the services that now, because of the challenge of the budget, is proposed to start in the second year or after maturity of the fund. So if funds are available before the second year, then it might be rolled out. And it's going to target screening for the top 4 cancers in terms of incidence in the country. And this is breast, prostate, colon, and then cervical cancer. And it will cover for screening for these particular cancers. And then I'll move into the social health insurance fund. And for these were the main benefits are, and you can see them. So we have outpatient care, inpatient, maternity and child health, renal care therapies, mental wellness, surgical services, oncology, medical imaging and other diagnostics, and then overseas treatment. So for outpatient in level 4, 5, 6, the proposal is to have it. So currently it's only going to cover for lab tests for these 4 priority diseases, that is diabetes, hypertension, sickle cell disease, and then COPD or asthma. And then for this lab test, it's only going to cover diabetes at 4,300, sickle cell at 6,800, and then hypertension at 2,850, and asthma at 700. So this means that when these patients are referred to level 4, they will still have to pay for consultation and drugs, as only the lab tests are going to be covered for now. The limit is currently once per year. And then for inpatient, he mentioned the scope remains the same as the one under primary healthcare. The only difference is now on the per diem reimbursement rates. So for level 4, it will be at 3,360, level 5, 3,920, and then level 6, 4,480. The limit is still 180 days per household per year. And then for maternity, we are looking at ANC and PNC being covered under primary healthcare, and then normal delivery, CS, postnatal care, immunization, and then we are looking at infections and management of complications and anti-D serum provision for instance, negative mothers. So admission is going to be done for CS. The reimbursement is 30,000 per beneficiary per CS episode. For normal delivery, it's 10,000. And then we are looking at deliveries taking place in level 2 to 6 facilities. And then I mentioned ANC and PNC services will be offered under outpatient in level 2 and 3 hospitals. We have renal therapies, and these ones will cover for consultation, temporary catheter insertion and removal. And then we have lab tests, nursing care charges, dialysis services, medication for these patients, and then dialysis as per the dialysis protocols is also going to be provided. So for him, the proposal is to have it reimbursed at 10,650 per session, maximum of 2 sessions per week. NHIF used to reimburse this at 9,500. And then for peritoneal dialysis, the reimbursement is going to be at 5,200 per month. So, and in case a top-up is required, then this member will be able to top up for this. We have introduced renal transplant package. And for this package, we're going to have a pre-evaluation limit of 150,000 per household. And then the recipient surgery itself is going to be reimbursed at 700,000. The removal of the kidney from the donor, that is the donor nephrectomy, is going to be reimbursed at 168,000. And then we will normally have those drugs that are required to reduce rejection of this transplant, and then also maintenance therapy. Those drugs are going to be provided for at a limit of 200,000 per household. And of course, this service will be offered in facilities that have the capacity. Mental wellness, this will cover for mental health education, counseling, and psychosocial support, screening, and then for behavioral disorders, neurodegenerative disorders, and the rest. And then it also includes rehabilitation for substance and related abuse. So for outpatient services for mental health, this will be covered under the normal outpatient visits. Inpatient services for mental health will also be covered under the normal per diem that I've mentioned. For rehabilitation, it will be reimbursed at 7,200 per rehabilitation episode. And then the limit will still be 180 days of admission. And then it will be assessed all across level 2 to 6 facilities. For surgical services, there's a surgical listing that has been provided, and this listing has the reimbursement rates per surgery. So it's more of a fee for service. And it will cover for admission, minor, major, and specialized surgical procedures, management of complications due to surgery, post-procedure pain management, physiotherapy, critical care services related to the surgical procedure, and immunosuppressive therapy for organ transplants. So I've mentioned about the listing. And then in terms of access rules, the limit will be 3 minor surgeries per year, and then 2 major procedures per year, and then 1 specialized procedure per year per household. Then for hemato-oncology services, hemato-oncology will cover for chemotherapy, radiation therapy, hormonal therapy, and immunotherapy. It will also cover for lab investigation, apharetic platelet and red cell exchange. Those are for sickle cell anemia patients, radiological services, surgical interventions, and then management of precancerous lesions. So it will be offered where facilities have the capacity to offer these particular services. And then diagnosis, staging, and treatment will have a limit of 400,000. And this limit will be 100,000 for diagnostic and staging, and then treatment will be a limit of 300,000. And then approvals will be guided by the MOH guidelines. There's a National Cancer Control Program guideline for management of the common cancers that has already been provided. And this is what will be used to offer this particular package. And then medical imaging and other investigations, we're looking at MRI, CT scan, CT angio. For under NHIF, MRI and CT scan were the main benefits offered under imaging across the board. And then we had introduced these other specialized like mammography, but only in government level 5 and 6 as a pilot. Now the entire scope is being rolled out for the entire population with a limit of 2 per household per year. So MRI at 11,000, CT scans at 6,900, CT angiogram at 8,000, specialized ultrasound and Dopplers at 5,000, EEGs at 8,000 for a child and 5,000 for an adult, mammography at 3,000, fluoroscopy at 4,000, and echocardiograms at 3,500. Oral health services is also proposed to start in the year 2 of the benefit package with a limit of 2,000 per household. And it will also be offered where capacity is available. It will include oral health education and counseling, screening and consultations, tooth extractions and fillings, plus suturing under local anesthesia, and also scaling and polishing, plus wound cleaning. Overseas treatment, the Act provides that SHA will only reimburse overseas treatment in hospitals where it has contracted and empaneled. Currently, NHIF never used to contract hospitals overseas. They only used to give guarantees of payment. So now overseas treatment cannot start until that contracting and empaneling is done. So this is going to propose to start within 6 to 12 months or as soon as the contracting is done. So the limit is going to be 500,000, and it will cover for medical and surgical procedures that are not locally available. TCIF, Initially, we had done a budget of 107 billion, and that was going to cover for chronic illnesses, assistive devices, critical illness like ICU, HDU, and severe burns unit. But now, after optimization, we are mainly going to cover ambulance, accident and emergency, chronic illness within the package, and then critical illness also within the package, and palliative care. So what we are looking at is for ambulance and evacuation, there's a tender that was done, so it's going to be competitive, and then it's going to determine what is going to be covered. So in terms of the scope, it's going to cover extraction of patients either from the point of incident where an accident has occurred, the nearest facility that has an accident and emergency center. It's also going to cover the transfer of patients where they require emergency services or further clinical care from one facility to another. So the management of ambulance is going to be done through a toll-free call center that is going to manage the ambulances that are moving around. And then I had mentioned it's going to be accessible to all Kenyans, whether they're registered or not. Emergency services, the scope is going to include cardiac and pulmonary arrest, major trauma, shock states, altered levels of consciousness, convulsions, chest pains or stroke, anti-snake venom, and anti-rabies. And the scope is going to be across level 2 to 6 facilities on a fee-for-service basis. And this is also going to be accessible to all Kenyans, whether they're registered or not. In terms of care, emergency service is only going to be able to take care of you within the first 24 hours. So after the 24 hours, then it is expected shift benefits are supposed to come in. And that's why members are being encouraged to register and pay up, because the government can only offer limited services. But now once you are registered, then you can see the range of benefits that you can access is quite a number. Illness, initially we had a rate for ICU and HDU, but now because of the optimization, it means we had to relook it. So currently it's going to be covered within the normal per diem rates, the ones I mentioned earlier, with a limit of 180 days per household per year, but this access is going to be across level 4 to 6 hospitals. Palliative care, more of the same as critical, but now for this it will be accessing level 3 to 6 facilities within the per diem rates with a limit of 180 days per year, and the palliative care benefit is aimed at helping and assisting those with life-threatening illnesses or severe chronic illnesses in terms of pain management, symptom management, and psychosocial support, plus end-of-life package. Assistive devices, this is also proposed to be rolled out within the second year as soon as funds are available in level 4 to 6 facilities. So hearing aids at 555,000, crutches at 900, foot brace at 1,000 shillings, therapeutic footwear at 1,000 shillings. So for hearing aids, it will be offered for those aged 18 years and below, and it will only be accessed once per lifetime for these beneficiaries. That's the summary of the benefit package. For every benefit package, there's always exclusions. And for this case, the exclusions will be cosmetic procedures, unless where it has been specified within the surgical listing. Of course, there are procedures like some plastic surgeries that are normally required after severe accident, and those ones, some of them have been covered. So if you look at the class of that surgery, you find it's a cosmetic procedure. But because now it occurs due to someone getting an accident, then now the reconstructive surgery, some of them are being covered within the package. And then treatment by herbalists, and then IVF. IVF is not being covered, not because we are saying it's not within the scope. It's just that currently it can't be afforded. And then vaccines, any vaccines away from the KP vaccine schedule, and then products out of the Kenya Essentials Medicines list or the Kenya Essential Diagnostics list, and then weight management drugs, medical costs related to or incurred in a research environment and clinical trials, and then epidemics and pandemics. Epidemics and pandemics are mostly managed through the Ministry of Health under the Public Health Department. And then we are also looking at professional fees for medical personnel over and above the prescribed rates, and then expenses related to diagnostic equipment, including but not limited to such as glucometer or glucose machine, and then any other procedures or intervention not listed within the benefit package. And then there are these vertical programs that we normally have, the HIV and the like. So ARVs, anti-malarials, anti-TBs, and associated tests, planning for commodities, and then KP vaccines will continue to be provided for at public, faith-based, and private facilities that report to the health information systems. So that is the summary of the benefit package. Thank you.
Thank you very much, Bwana Otieno, for that presentation. Members, I hope you are still noting your questions. I'm seeing some on the wall. So now I'm told the PS is ready to join. Unfortunately, the capacity cannot allow him to join. We are waiting to see what we can do so that he can also address the forum. In the meantime, we will proceed with the presentation. Allow me to invite Bwana Osoro to take us through the employer portal. And I know this will be of interest to us as HR practitioners, so please take keen interest. Bwana Osoro, welcome.
Thank you. Good morning. Can you hear me?
Good morning.
Thank you. I want to take you through the employer portal. Before I commence, kindly confirm whether you can see what I projected, what I'm sharing.
Yes.
Yes, you can see.
Thank you for this matter. As Oscar indicated, my names are Gilbert Mogami Osoro. I serve as manager, Universal Health Coverage. Part of our mandate is to ensure that all Kenyans have access to an affordable, accessible quality health coverage without exposure to financial hardship. I'll be taking you where the rubber meets the road, that is the employer portal, whereby it is expected that come end of this month, the due date, which is 9th of November, you will have registered your entities to the SHA portal and make monthly returns, what we call the monthly payroll returns that you used to do under NHIF. Now, when you log into the SHA portal, specifically, you will see the employer portal, and it is expected of you to first of all register as an employer to the SHA portal. And this is done by either three methods, which I'll be able to demonstrate down there. What you are currently seeing at the screen is the SHA portal, whereby employers are required to register, or for those already registered, to log in for purposes of making returns. Allow me to mention something on registration. And as you may note, we have an integrated platform that ensures that various groups can register efficiently. The SHA system allows employers to enroll their employees online and ensure prompt access to healthcare services. When we talk of universal health coverage, we are talking of access, which is the key. And all employers are required to register with SHA as per the law established, and the process has been made seamless. You can register through four methods. Number one, you can register using the NHIF employer's credentials. Employers previously registered under NHIF are automatically migrated to the SHA portal and are required to update information on the SHA digital platform, the digital superhighway, for the continuity of services. When we talk of employers previously registered, what we need of you is the employer code, which you had previously under NHIF. We also need the email address and, of course, the password, which is known to you. You can also register to the portal using the NSSF employer details, whereby employers registered under SHA as part of the government effort to integrate social security services. SHA has integrated with NSSF, so you can use your NSSF credentials to be able to update or register into SHA. Now, there are two new developments. You can see we recognize that UHC is whereby all Kenyans have access to health coverage. And in the spirit of UHC of living no one, we have provided a portal platform for registration of domestic workers. They are called house managers nowadays. For domestic employees, SHA introduced a simplified process allowing employers to register their domestic staff for health coverage. The process has been designed to ensure that workers in the informal sector who were previously underserved by NHI now receive comprehensive health coverage. Finally, the fourth way you can register is that you can register as a new employer. By a new employer, you are a newly established business and you want to comply with the law. You need to register your employees with SHA as part of the compliance with the national regulation. Now, for purposes of this meeting, to access the SHA portal, you need to click the following URL, which is https://employers.sha.go.ke. I'll be sharing this user guideline at the end of this presentation. As I indicated earlier on, you need to choose the type of registration and have indicated the methods within which you can register with either NHI services, NSS, new employer, or a domestic employer.
Bwana Osoro,
Yes?
you are getting a bit unclear. I don't know what has happened.
I don't know whether it's my network that is fluctuating. I can see. Let me try to check whether it is the internet. Give me 2 minutes.
Or mute one device. Mute one device.
Maybe there are several devices in his room.
No, it's only one. It is one. I don't know whether the system is overloaded. Can you get me loud and clear? I'm using a new LAN.
There's a lot of effort.
Your voice is shaking.
Let me see whether I tether my phone for purposes of the meeting. I know. Give me a second, Oscar, to change my access point so that we can be on the same page.
It's okay. Harakisha tafadhali.
I'm doing so right away. Confirm whether you're getting me loud and clear, team. Oscar?
There's still the echo.
I don't know what is causing the echo, because I'm only using one device here. I'll try to moderate my voice so that you get me. Oscar, can you get me?
There is still an echo.
Once you hear me, please confirm. Allow me to proceed, whereby we will go to how to activate with the NHI e-services or the byproduct portal. Allow me to mention something on that particular portal. This is the page, and on the extreme left, you will see something activate with NHI e-services. Now, what is required for one to activate with the NHI e-services? It is a mandatory requirement to capture the employer code or number. The other thing you need to capture. Yes?
You know, this was the gist of the matter for the HR practitioners. Unfortunately, yes, you are getting unclearer and they may not get what they really wanted to get at the end of the day. I don't know what you can do so that you are clearer for them to get the issues.
For me, I would suggest that he has a 90% trust. There's an echo. That means there are two devices.
I don't know why it's let me get a 90% Oscar here.
Are you in your office? I can send someone to look at it.
Kindly, we can take a 5-minute break with the indulgence of the chair so that we sort out the IT issue.
A proposal that he actually does the demonstration practically. Since we'll be going through this reading, we can read, but would like him to go through it practically.
Noted. Let me try to get our colleagues from Convergence because we need access rights to the portal so that we log in. As we continue, I'll try to talk to them so that we have accepted right. Oscar kindly dispatch someone from ITD to appeal to see why we do have the ego.
Victor is on his way coming.
Okay, thank you.
Ladies and gentlemen, as Mr. Osoro reorganizes himself, I am informed that the PS has logged in. So allow me to ask the PS to address this forum, and then thereafter we go to Mr. Osoro. Bwana PS, karibu sana.
Hello.
Hello. Karibu Bwana PS.
So maybe we
Good afternoon, can you hear us?
Yeah, we need to plan who are the organizers of the G7, who are the organizers of the housing program.
So
we just need to see how do we leverage on them. Sometimes, so maybe we
Yes.
Okay. Hello, Oscar. Oscar?
Hello, yes.
You can hear me?
Yes, I can.
Okay, let me try to connect the PS now.
Okay.
Oscar? Oscar,
Yeah.
you? Okay. No, the PS is on now.
Okay.
Oscar, how are you? Good morning.
Good morning, sir, and welcome.
Thank you. Sorry, we had that hit, and I think we got a little bit of mix-up.
No, we are ready for you now. You can address us. Karibu sana.
So maybe give me a brief of who is in the meeting and where have you reached so that I'm able to address you.
Oh, thank you, sir. This is a meeting on the SHA transformation to SHA, and we were addressing the HR professionals. Today, it was the HR directors and professionals from SAGAs, public universities, commissions, and independent offices. So we've had, sorry?
Proceed.
We've had presentations on the legal provisions, the legal background. We had a presentation on the benefit package, and we were finalizing with the employer portal that would enable the HR practitioners to detect and meet to NHIF. On board, we have about 500 practitioners, and that is the capacity of the portal. We have more still waiting, but we have lined up more presentations virtual in the days to come, up to 31st of this month. That is where we are, sir.
Okay, thank you. Thank you for inviting me to give my remarks. I want to welcome all of you to this meeting. This meeting had been planned through the State Department for Medical Services. You are aware that we started with the directors of human resource of all the MDS, which was done at the KSG. And because we needed to cover the entire public service, it became difficult for us to continue training at the KSG because we needed everybody to be on board, and that's why we opted for virtual training. And thank you for bringing the 500 professionals and HR directors across the commissions and the sagas. Actually, this is also a follow-up to the directives from the head of public. The directives from the head of public service. I don't know if all of you have received the directives from the head of public service. As we are rolling out the social security, one of the key requirements is those who are employed need to update their status through the employer portal. Now that's a very critical exercise. You might think, why are you pushing this exercise? It is indeed a very critical exercise when the employee goes to the facility, the hospital, and if the details of the employer has not been uploaded, the ability of the system that they are not eligible because they have not.
We've lost the principal secretary. We can't hear you, sir.
Bwana PS, we've lost you.
Is the PS still speaking?
Why can't we go to the other presentation as we wait for the PS?
Ladies and gentlemen, please be a bit patient while we try to reconnect the PS. If it won't work, then we'll proceed with the presentation as we wait for him. Just a moment, please. Yes, sir.
Ole, we are having a challenge with the internet.
I have unmuted you and you're on speaker, sir.
Thank you so much.
Kindly let members confirm that they can hear you. Can you hear the PS members?
Yes, you can.
Loud and clear.
Yes, please continue.
Okay, thank you. Thank you for getting me, and I think we have this alternative. I was just concluding by saying that we needed your support to ensure that all your employees are uploaded into the portal for the purpose of continuity of medical care for your employees. I know our teams have also been with you. Our teams have taken you through. I've seen there's a lot of questions being asked by us. How do we onboard the beneficiaries? And I think our teams are there to guide you and to answer most of those questions. But the key issue here is we needed to onboard the staff. It's a simple process that needs to follow, and we are behind schedule. If you still have challenges in terms of you need more information, you need more training, I think we can structure it in a manner that we are able to take you through in an organized manner, so that you're able to become the champions of enrolling members and sensitizing the public and our officers in terms of what are these benefits. We've requested the directors of human resource to organize for sessions within the organization, so that we bring in the team from SHA to take you through the benefit packages that are available within the new social health insurance funding model. So I think the key one for today was basically just to take you through in terms of uploading employees. But getting from the comments that members have been sending, I think it is important that we organize through the HR training sessions for each of the organizations. We'll be glad to send there a team from the social health insurance, that SHA, and the minister as well to take you through the benefit package and how beneficial the new tariffs are to your members and to the public. Thank you, Oscar.
Yes, thank you for the remarks, and I hope members will pick it up from there once we are done with this program. Thank you, and have a good day.
Okay, fine. Yesterday, just for information, yesterday I reported to the head of public service in our meeting of updates that this training is ongoing, so he's aware. And he had requested even that we get in touch with the secretary, Mr. Simon Indimuli. And I think I'll just notify Indimuli that this training has taken place, where most of the sagas are now being trained, and I believe we have achieved our objectives. Thank you.
Thank you so much. So members, we will continue with the presentation. And I've had to summon Mr. Osoro to my office so that we continue uninterrupted.
Morning, members. Sorry for the challenge that we had. I hope you are getting me loud and clear now. Can I get
Yes, now you are clear. You're not echoing.
Yes, you are clear.
Thank you. I think we had a network issue.
Yes, you are.
For the benefit of the members who've just joined us, and I was making a presentation on the employer portal. I don't know whether you want me to start or we pick up from where I left. I need to be guided.
Start.
I would suggest you restart.
Yes.
Start. I appreciate that, and I want to start by saying that I'll be making a presentation on the employer portal, and I'll be sharing with you the user guides. And one of the members requested that we have a live login to the portal. I've requested for rights because it's only employers that have rights who can log in to that portal. So when you log in to the SHA employer portal, that is the landing page that you'll be able to see. Allow me to take a deep dive as we work together. Now, when it comes to registration, because it's mandatory that all employers are registered to SHA pursuant to the Social Health Insurance Act number 16 of 2023. And the SHA portal is integrated, whereby it integrates to other portals, including the National Social Security Fund, the former defunct NHIF, amongst others. And all employers are required to register. And the registration process has been made seamless for employers, such as, one, you can use the login credentials of the former NHIF, whereby employers previously registered under NHIF are automatically migrated to SHA and are required to update information on the SHA digital platform for purposes of continuity. I want you to take note that we are not reinventing the wheel. For you people who are already employers in the former NHIF, what you need to do is to update the details that are captured in the database as we enroll for SHA. You can also use the NSSF employers details, whereby employers registered under SHA as part of the government effort to integrate social security and healthcare services, members need to link their NSSF details with the new SHA system. We've also provided a new entrant whereby we have made a provision for recruitment of domestic employers. For domestic employers, SHA has introduced a simplified registration procedure, allowing employers to register their domestic staff for health coverage. Of particular note is that the process has been designed to ensure that workers in the informal sector who may have been undercovered by NHIF now have access to comprehensive health coverage. Finally, for new businesses that are being registered, they are required to register their employees with SHA as part of their compliance with the national regulations. And for purposes of accessing this portal, you can visit the URL that is listed below, whereby it is https://employers.sha.go.ke to log in. Don't strain writing, because I will be sharing this user portal to Oscar, who will share with you for purposes of ease of registration. I've indicated the avenues within which you can register, but allow us to go to how to activate with the NHIF e-service what was previously known as the byproduct portal. Now, when you go to the...
Please share your screen.
Oh, you are not seeing my screen? Sorry. I thought
We are
it
not.
was...
We can't see it.
Let me share. Many apologies. I came straight to Oscar's office. I erroneously assumed that the screen was shared. Let me share. I'm trying to share. Who has the login rights, Oscar? Not sharing. Oh. Put the full screen. It is not full. Not here. It is there. Kindly confirm whether you can be able to see the screen. Can I get a confirmation that you can see my screen, which is written type A? Activate.
Yes.
Yes, now it's okay. Yes, it is.
It's clear now.
It is okay.
We give glory to God. We'll pick up from where I stopped. So activate with NHIF e-services, which is known as the byproduct, which you use to submit. Now, the employer will input the employer code. I know all of you have an employer code. You are also required to enter the NHIF registered email address and the byproduct password. I know most of you have passwords, sorry. Most of you have passwords that you registered previously with NHIF. Of particular note, you may not navigate beyond this screen without inputting those key 3 parameters: the employer code, the registered email address, and the byproduct password. And at this juncture, if you have your laptop there, as I speak, you can request one of your guys to log in so that we work together. I believe learning by self-discovery is the best form of learning, as I try to wait for the login credentials. Now, once you successfully log in, the employer will be directed to this page. And this particular page is where you update your records. Allow me to speak something briefly on this page where you update your records. There are mandatory fields that you are required to update. Number 1,
the screen will automatically populate the organization name, and you are supposed to update the contact name, the person whom can be reached in event they want to be reached to. You need to update the physical address. You need to update the contact phone number of the person who will be appointed to administer this screen. You need to populate the postal address, the KRA PIN, but of particular note, you are required to upload 2 key documents there. The first one being the registration business permit. I know government does not have registration business permits, but you can register your registration either as a university or a SAGA. The other key one is the KRA PIN certificate. Now, these ones can be uploaded if they are PDF documents or JPEG, and the maximum size of the image that you can upload is 2 megapixels. So that is quite huge. The other thing you need to do is you need to indicate the admin details, the administrator of this particular account, whereby you have to indicate the first name, the last name. You need to indicate his cell phone number or official number that he can be reached to, the email address of the employer, the company. You need also to confirm the particulars of the email address. And finally, you proceed to submit. If all details are correct, because this system has an inbuilt artificial intelligence system, it will go through. If they have an error in terms of either the address, the PIN certificate, or it's unable to upload, it will reject and indicate in red why your application has been rejected. So you'll need to go back and update. Of particular note, when it's rejected, I note both the uploaded document, that is the business permit document, and KRA pins disappear. So take note, when it has rejected, you will need to upload those documents afresh. Now,
maybe before you proceed,
yes.
Godfrey Omondi.
Yes, Godfrey.
Thank you. Maybe can you go back to the previous slide? That is number 6. Just scroll up.
Yes.
There. Now, I've raised this question several times. We have facilities that have got different branches.
Multiple employer codes.
Yes. In this case, in this case, we have different branches. One of the branch was successfully registered, but upon trying to register the other branches, there was an error that the KRA PIN has been used. Yet this is one organization with different branches. And we also have different employer codes. So we were stuck what else can we do on the KRA PIN, because it is one for the organization?
Indeed, I appreciate your question. There are quite a number of employers that have multiple codes, and the same issue has been brought to our attention. I want to promise the team that we are working currently with the developer to provide for registration of multiple employer codes using one KRA PIN. You'll allow me, because we'll be communicating back arising from this meeting, the progress that has been made to activate those multiple codes. And for purposes of this meeting, kindly tell me the employer, you can inbox the employer, so that even as I do a follow-up with our colleagues here, we can be able to cite your case with specifics. Thank you, Godfrey.
Thank you for the clarification. We are waiting.
We will do so before end of today and get back to you. Tim, can I proceed so that we go through it, then we take questions later? So the other way you can be able to activate your accounts is using the National Social Security Fund credentials. Just like NHIF, you will be required to, first of all, click at the top there, activate with NSSF e-services. When you come to the organization details, you will also be required, amongst other things, to indicate the employer number, the e-service username, which is for NSSF, the e-service password. Finally, you will be able to submit. Now, I'll dump the verification screen because we've already done the verification for NHIF. I did indicate it is similar to what we will also use for NSSF. But allow me to briefly mention something on new business. To register as a new business in the SHA portal, the user will be required to complete that particular form that is displayed there. And one of the things that they will need to do is that they need to submit the following details that are mandatory. Number one, for new employers, they must indicate the fact that they must capture the organization name, the contact number. They must also capture the physical address or location, the postal address, the KRA PIN number. They must upload the following 2 documents. Number one, the business registration certificate, either through JPEG or PDF, in case to the KRA PIN. The other thing, they need to update the admin details by giving us the first name of the administrator, the last name, the phone, the contact phone for the company, the email, official email address. They need to confirm that, and they need to submit for purposes of registration, whereby they'll get a new employer code, which is issued by SHA, that shall be sent directly to their official email. For the new domestic employer, to register as a new domestic employer on the SHA employer portal, you must complete the following form. You must first of all highlight that you need to register as a domestic employer. You need to update the following employer details: the first name, middle name, last name, the national ID number, the KRA PIN number, the phone number, the email address, and you need to confirm the email, and the registration number from SHA will automatically be sent to the registered email. I want you to take particular note in step 2 now. You have successfully registered. Step 2 is whereby you set up the password that will be used to access the portal. This unique password will only be available to the registered users, and the employer will receive an email to allow them to set the password. The password setup instructions are shared to the email provided in the page that will be shown below. You can see this is how you need to reset your password. You need to enter the email address where the password will be sent. Now, when you receive the email, this is what you will get in your inbox. The user will check the email and set the password as shown below. Subject, it is set password notification, and there's a welcome note from SHA. You will click the blue button which is indicated set your password, and it will take you to the page where you will set your password. This is the particular page I'm talking about. The user is required to fill in these fields, what I call mandatory fields, and they will be the credentials used in conservative logins. So you need to register this somewhere so that you don't end forgetting. One, you need to indicate the email, which automatically will be pre-filled based on what you registered. You need to write your password, and it's a requirement of the system that you confirm that particular password before you submit, as indicated there. Once you submit, it will allow you now to log in as a user in the SHA portals. Your credentials, after successful password creation, the user will be required to log in using the credentials that you created as shown below. You will enter the email address, the password, and proceed to log in. Now, once you log in, The user will be required to enter the credentials of a one-time password for purposes of verification. Clara, I can see your hand raised up. I'll pause there so that I take your question. Proceed. Clara. So allow me to continue. You will get a one-time password because for purposes of accessing the SHA portal, it requires a two-step verification as shown below. And the code will be sent to the registered email address and simultaneously to your phone number, whichever you can access either the email address or phone number. Now you need to enter the one-time verification PIN as indicated below in the box and proceed to log in. The purpose why we've put in a two-way verification is for purposes of security so that no one can be able to log in unless they are recognized in the system. This is a sample SMS that you'll receive either in your cell phone or in the registered email. And it will indicate the OTP code and of course from Social Health Authority. Allow us to proceed because we want to log in. This is the sample mail OTP, which will of course welcome you, indicating your name and the one-time password. I want us to proceed to the actual logging in now. We've landed, which is step 4 at the dashboard, which is the landing page or what we call an overview. On successful validation of the one-time password, the user will be logged in into the SHA employer portal and you will be able to see the following. You can see the payroll data. You can be able to download the monthly payroll template. I know you're about to ask me, how do we get the monthly payroll template? It is provided for. So you can click download and you can be able to download the templates. I'll talk later about the template which are provided for, but the other details you can be able to see is your profile, the organizational profile, which is just below there under home, the name of your organization. There is a statistics summary of number of employees, the submissions, the e-slips submitted. We have the transaction history. You can get these in the dashboard and it's very interactive. As we start making submissions, you can be able to query, see your contribution history. Allow us to go to the point of downloading the payroll template, which I'll humbly request in your free time you make effort to download. Remember, this template is what you will be able to use to populate and upload. So you click download payroll template that is highlighted, and the template itself is down there. I want us to go to the template so that you have a look at it. This is the payroll template that you will download. The contents of the payroll template include the payroll number for the employee, the first name, the last name, the national ID number. There is a new entrant, which is the KRA PIN. We've introduced a column known as gross salary. Then we have the contribution amount, which is 2.75% of the gross salary. And last but not the least is the cell phone number. Of particular note, the contribution amount is 2.75% of the gross salary as established pursuant to the Social Health Insurance Fund Act that was passed by Parliament. Once you populate this, you will be required to ensure that the accuracy of the data and need to upload it for purposes to create an e-slip that will enable you pay. Now, we have made an additional component in uploading whereby you may note that in a particular month, you had 1,000 employees. But in the course of the month, as you are doing the returns, there are two or three other employees. Yes, Godfrey?
Excuse, sir.
Gilo, proceed.
Yes, when I upload that template.
Yes.
Mine does not have the column for gross salary.
I will be able to check this. This portal, the user guides were done earlier. I'll confirm from an actual download. I know there were some changes that were incorporated, but allow me to confirm.
Okay, thank you.
Of particular importance is adherence to the act, that is contribution amount at 2.75%, but I'll issue a clarification as we continue.
Okay, thank you, sir.
Welcome. Now, we have made it easier for HR managers. In the past, when you wanted to upload multiple byproducts because of circumstances, you had to seek permission from the branch manager to do so. But in the new portal, we have made a provision whereby you can add employees manually. There is a button there just after the byproduct that is written, add employees manually. You've submitted your main payrolls. There are 2-3 other people that are missing. You click the add employee button to manually input data. And the following fields are required: the NSSF number, payroll number, other names, ID number, gross pay, KRA PIN, voluntary pay. You need to save that data and update for it to automatically be uploaded. Sorry, my screen is jumping. This is where we add persons. You can see the NHF number, payroll number, first name, last name, the surname, ID number, KRA PIN, gross pay, and voluntary pay. You enter, save member, and you submit. Now, I'll talk to something that is very important, is how to creating submissions. You have already populated the templates, and it is time to submit the same way you'll submit in the month of November, very soon. The user selects the submission month. In this case, your month will be October 2024. And we have a calendar there whereby you select the month of submission. Once you click, the payroll, the template has been automatically configured to give a summary of what you are uploading. From the employees, you can see it has indicated 2 active employees. It has indicated their full names, the ID number, the phone number. There is something that is called CR number, which is client registry number. When this one is automatically generated by the system upon successful submission of the byproduct. We have indicated the SHA ID number, the contribution amount. It will indicate the status that you are a member of regular and good standing, and it will indicate the last update, either 2 or 3 hours ago. You will proceed and submit this. This is evidence of successful submission of data, and it is a permanent record that will be captured in your overview. Allow me to mention something on my organization, which is under my organization, the user can view the organization details or add other users to the system. We have the payroll manager, we have other people, senior clerks who work under him, so that in the event you proceed on leave, submission does not come to an end. Now you can add other users. You are the first user as the HR director or manager. You can add other users depending on the need, the people who have been given payroll rights. You need to indicate the contact email, contact phone number, the physical address, postal address, number of users. You can indicate 1, 2, 3. You can indicate their login credentials. And what the good thing with this, it shows you the users and the status, when they last used, the date was created, and action, how they've been submitting. So you can have an audit trail of the users that you've nominated to access this system. Allow me to share something on adding users. And the user clicks on the add user button, and you need to input the following details: the first name, the middle name, the email address of the user, the phone number, and you need to define the user type. You could be the admin. We have guys from finance, from operations, and based on the user type, it will classify who has rights to upload or amend things on this portal. The other key thing you need to be aware of is how to reset your password. In event you click your password, we have provided for a reset. You click on the forget password and provide your email address to regain access to the account securely. You will get, once you submit this, it will send you the one-time password to reset your login credentials. As you can see, you will land to that particular screen where you can be able to reset your password for the Social Health Authority. Now, the following instructions are sent to your email to reset the password. The user clicks the green password box as shown below. Once you reset you click the reset password screen, it will allow you to enter the new credentials. Amongst others, it will ask you to enter the email address, the new password, and you need to confirm the new password before you submit. You can see it's user-friendly, that you can be able to navigate it on your own, of course, with the user guidelines that we'll be sharing. After successful confirmation of the password, the user will be required to enter the one-time password sent via mail or SMS, and it's a 5-digit number that you'll use to populate there. You proceed and log in. That marks the end of my presentation. I want to thank you for your patience despite the challenge we've been able to navigate. I know you wanted a live login. I've not gotten login credentials, but I'll be able to take in questions. Over to you, Oscar, Chair.
Thank you, Bwana Osoro, for the presentation. Members, I believe you followed closely what Mr. Osoro has presented, and that at the end of the day, you will be able to implement the same in your workplaces.
I need a clarification. Are we allowed to Q&A?
Hello? Are
I'm
you
asking
allowed
to Q&A question, and then we expect some answers. Just one clarification I'm seeking.
A clarification before the Q&A?
No, at this point, am I allowed to ask a question, or maybe I can wait until?
That is the session we are going into right away.
Okay.
The Q&A session, the plenary. So Bwana Osoro is here. Mr. Otieno, are you still around? Bwana Otieno? Nyarongo?
Yes, I'm still here.
You are still here?
Yes.
Okay. In the meantime, I'm looking for Bwana Otieno. So we can have the Q&A session. And I'll preside over the same. Now, say who you are directing your question to among the three presenters. If it is Nyarongo, Nyarongo was the first presenter, Otieno was the second presenter, and Osoro was the last presenter.
Okay, I'm addressing.
Good morning.
Morning. Who is this?
This is Samuel Korea.
Yes, Samuel.
My question is to Mr. Osoro on the presentation on the uploading of the e-slip. Previously in the NHIF portal, you could not be allowed to upload like 2 separate file products. I don't know if the new system can accept, or you need to consolidate, because some of our organization, we file return on behalf of other employees, other employers that are not registered in Kenya. So initially we could combine at least like for 3 to 4 different employers and submit as one pie product. So I wanted to confirm with the new system, will it allow us to file separate law? We need still to continue to submit as one, compile the list for several employers and submit as one pipe product.
Another question to Osoro.
Yes, I'm seeking clarification on when he says gross salary. Does that mean the basic salary, or it means including the allowances?
Okay. Any other question for Bwana Osoro?
Good morning.
Yeah, I have a question. Good morning. I'm Stephen Ogembo.
Yes, Steve.
In relation to the registration process, once you've initially, when we tried to register and activate using the E key that was being asked, it wasn't working. So we went ahead and just registered a new business. What's the consequence for that? And we have to go back and amend that because we already registered as a company under SHA, and we added all our employees under new business, though we were registered with NHIF.
Kindly allow Bwana Osoro to answer these three, then take more.
Good morning. I had one burning question for Bwana Osoro.
Osoro, yes, okay.
So initially, I'm Felix from Nakosti.
Yes.
Initially, we started creating users manually. And we added 3 employees before we realized we could upload the Excel template. So we populated the Excel and uploaded, and it inactivated the first 3 that we created. And we don't see how to reactivate them. So all the others are okay, but the 3 that were created manually are inactive. Please, if you can assist on that.
Okay. So Bwana Osoro will answer those 4 questions first. Over to you.
Thank you, Tim. And I thank you for the wonderful questions that you've asked, which will provide insights. I want to start with the question raised by Samuel Kuria.
Please kindly mute participants.
Samuel Kuria did indicate that they have multiple monthly payroll byproducts because they file returns for other entities. And it was the same question that was asked by Godfrey Ogola earlier on. And to clarify that at the moment, the system only acknowledges the system only acknowledges one Excel sheet, but we are working with the system developer to make a provision.
Lawrence, kindly mute. Lawrence Karaoke, kindly mute.
Allow me to make a clarification. That currently the system architecture only permits one payroll byproduct to be added. But we are currently in talks with the developer to make a provision for additional monthly payroll byproducts. There could be 2, there could be 3 or 4. We shall be communicating before the end of the week to provide guidance on how you can upload multiple byproducts. It's works in progress. Allow me to say something on the issue or a clarification on gross salary. And this one I'll request Oscar, the HR experts, to define what is gross salary, because I had someone say whether allowances are gross salary.
Thank you, Bwana Osoro. I think as HR practitioners, we understand what gross salary is. It's the best salary plus the allowances that an employee is paid. I think that is clear.
Thank you, Oscar, for this. Ogembo, you raised an issue pertaining to registration as an employer, whereby you did indicate that instead of activating using the NHIF e-services or NSSF e-services, you registered as a new employer. And you wanted a way forward. We have such a number of cases that have come to light, and we are working with the developer to provide a simple avenue to to allow you update your details so that we can link your details with the defunct NHIF and NSSF. We have so far made substantial progress, but allow me also to communicate once that particular portal for updating employer details for people who registered as new employers is completed. So I want to rest it there. The other question is from Felix from Nakosti, who did indicate that before they could get access to the template, they proceeded to upload 3 employers manually before they realized that there was a template. And after they used the template, the 3 employees were automatically deleted, if I got you correctly. Now, you had me indicate that under this new portal, it provides for adding provides for adding employees manually. For the 3 who disappeared, you can proceed and add them manually and proceed to save. They will be uploaded. I hope that rests your questions. We can take further questions once again.
Osoro.
Yes.
Just to clarify, I think I'm able to see them.
Mm.
I actually tried adding, and it's not. I actually tried adding afresh as new employees.
Mm.
It did not go through. So they are existing, but are existing as inactive users, inactive employees.
Now, when it indicates inactive employees, I did indicate this system as an inbuilt AI system. Either the details were not complete, that is why it indicates the inactive, but for me to be able to respond comprehensively, you can text on the text box your details, or you can take my number, which I'm ready to share. You can WhatsApp in those details, your employer code, so that I look at the back end and see the reason why they appear as inactive. For purposes of this meeting, my cell phone number is 0724 40 9619. I repeat, 0724 40 9619. My email address is gosoro, GOSORO, @nhif.or.ke. I humbly request Samuel, you kindly do an email highlighting your issue to enable me pick it up with the software developer. Thank you.
Thank you.
Thank you, members.
I have a question.
We're still here waiting for more questions.
Yeah, Helen,
let me go first. It's about currently the template do not have the salary, and
we are losing you. You are breaking. Kindly ask again.
Sorry for that. Currently, the template do not have a field on a gross salary. It actually contains a field on NHIF number.
I want to allude, it is true, I've just checked the template. There was a request to remove the gross salary. We just leave it at as it is. So members stand guided. The gross salary currently does not appear on what is live in the system. Thank you for that observation.
Thank you. And then one more question is on the insurance relief. Do we still apply the insurance relief as it used to be in NHIF, the 15%? And one last one is that I tend to believe the employees had an obligation of registering themselves, and as HR, we were only supposed to register the organization as an employer. I also stand guided because our employees currently are doing their own registration in when we will be uploading the byproducts at the end of the exercise, at the end of the month. Thank you. And as HR, we were only supposed to register the organization as an employer. are also stand guided because our employees currently are doing their own registration.
Thank you, though we've lost you. You've asked two questions in one. I want three questions rather. The first one pertains to tax relief. Under tax relief, I want to say this. In the previous NHIF, tax relief was provided for under Section 31 of the Income Tax Act, Cap 470 of 2021, which provided that a resident individual eligible for personal relief may qualify for insurance relief, including contributions made to the National Health Insurance Fund under Section 31, Section 5 of that particular act. I will request my brother, Archibald Nyarango, because the wording that is captured here is may qualify for insurance relief, including contributions made to the National Health Insurance Fund, that is NHIF, under Section 31, sub-article 5 of the Act.
Yes.
Now, as you answer the question, you will also tell them about the transition of the assets and liabilities of NHIF, and same case to this matter. Proceed, Archibald.
Thank you for that, Mr. Osoro. It's actually a question that has come up several in the chat. And the response is that usually tax relief is very specific to the organization to which the amount is applying. So because the law has been very categorical that it's NHIF contributions that are being subjected to tax relief, the likelihood is that there needs to be an amendment to the Income Tax Act. Just like there was an amendment to create that tax relief, there must be an amendment to the Income Tax Act. Now say that contributions to the Social Health Authority are also now going to be subjected to the income for tax relief. Will also be covered by the tax relief. So that's my take on that. However, it's also something that we could also take on board and request a clarification from KRA, that employers are not left confused about whether they're applying tax relief or not, so that everyone is on the same page. And if it requires amendment, then the government can also be requested to expedite the same. On the transition clauses, I'm not sure if I got the question right, because perhaps you can let me know, Mr. Osoro, what exactly was the issue on the transition?
Actually, you answered it because I wanted to know whether, now that they say the asset liabilities of the former NHIF were transitioned, you've clearly said this law was not transitioned, it was specific to NHIF. I think you've rested the case.
Okay.
So let me respond to the other questions.
Just a follow-up on what you have said on the relief. So currently, before the amendment of the income tax, we are not supposed to give relief to the chief. Or what's the stand?
No, yes, that is understanding, but I mentioned this is something that has come up severally, so we'll need a specific clarification from KRA so that employers know exactly what is going on. But my understanding is that the relief was very specific to NHIF, and even the provision specifically mentioned NHIF contributions. So for social health insurance, they will need to amend that specific provision to allow for that tax relief.
Okay, I wanted to ask a question on staff who are expatriates, who you have hired and they are not locals. We've been having a challenge trying to register them, or them doing their own self-registration. Could you shed some light on what to do with expatriates and people who are working here who are not Kenyans?
Thank you. Very important question. Indeed, we have noted that currently the way the system architecture is configured, it is integrated to the National Registration Bureau, which is the single source of truth. And as you indicated, expatriates, refugees, and others who work here are not identified through NRB. We have worked with the provider, and as far as Friday last week, they did indicate they have made a provisions whereby you can directly capture either the passport number, the alien certificate, or the work permit for those expatriates. But allow me, because as far as Friday, it was a test module. I'll confirm whether it's been deployed in a real environment for you to be able to proceed. It is works in progress. I'll be able to respond. You can also write to my email or call me for confirmation of the same. Thank you.
I have a question.
Yes.
My name is Terry.
Yes, Terry.
We managed to register as an employer where we activated with NHIF e-services.
Mm-hmm.
And we got a notification email on in my email address, and we activated where we changed the password. However, from there we do not know where to log in again. Like, where are we supposed to log in so that we can key in the details for the employees and all that? In the website, we'd want to know where, if now we want to log in afresh, not like registering, but to log in so that we can update the employees' details. What are we supposed to do?
Now, you will go back to the start, and I'll share this portal, this user guide with you. At the start, it provides for two things: registration as updating of your records, or login afresh as a registered person. And to show you that particular portal, you can see where we have two things. We have login and register. You need to go to the portal written login, enter the email address, enter the password, and proceed to login, and the one-time password, proceed to login. Kindly try logging in, because once you log in successfully, having registered, you are supposed to come to the dashboard, whereby you can now be able to check and upload your byproducts. I hope you are together, but you can side chat me after this meeting so that we work together. Thank you.
Thank you, Mr. Soro.
I have a question.
Yes.
My name is Victoria. On the registration of the employer, there's a provision for an admin where you put your email address. So suppose maybe sometimes the email addresses, they become inactive for some reasons. So I didn't find a provision where somebody can change the email addresses, or where they can change the admin. Maybe you can assist with that.
Now, if you look at admin, when we talk of admin, it provides for 3 other alternative persons to be able to access the portal. But I hear your concern. How do you provide for change of admin in event the admin retires? What happens? It's a question that, it happens. We have admins retiring, and there is succession in every organization. At the moment, we have not made a provision for how to exit an admin and introduce a new one, succession. Allow me to reach out, because we provide for the admin and the other users who will assist the admin. But exiting out an admin is something we are not envisaged. Can you allow me to respond later on as I will reach out to the developer?
Okay, thank you.
Okay, I have a question. Yes, a question still on the relief. If you don't mind repeating that act that you read, it exempted contributions sent to insurance companies, and it mentioned NHIF as an example, one of those companies. So I'm wondering why we will need another amendment to put SHIF there instead of NHIF. Yet NHIF was just given as an example. And in my opinion, SHIF is an insurance company, because SHIF in full is Social Health Insurance Fund. Therefore, this relief applies to SHIF just like it applied to NHIF and any other company.
Actually, for purposes of clarification, I kindly respond to the question asked, why only NHIF
Thank you. Yes, thank you. So I don't have it in front of me. I'll just find it in a moment. But the exact wording was it was not given as an example. It was given as insurance premiums and NHIF contributions. So it was not saying insurance premiums, including amongst others NHIF contributions. So it's the wording that is the problem, and that is what is creating that my opinion that it needs an amendment to be clear that its social health insurance will also benefit from the same. But as I said, it's something that you are reaching out to KRA. So if the actual tax authority says something different, we would go with that. But it needs to come out clearly, because even for the representatives here, it's not just the representatives here, but other employers are asking us the same question, how to apply this relief and whether to continue applying it to their contributions. So I take it that is urgent, and we're reaching out to them to guide us further on that. Because it's an amendment, just to be clear, it's an amendment to the Income Tax Act, not anything to do with the Social Health Act.
Okay, another question. Question on KRA. I was also asking, if you are consulting the KRA on the tax relief, could you also engage them on the definition of gross income? Because, for example, when you are implementing the housing levy, they came to some point and explained what gross income constitutes. For example, if some of the incomes are not permanent, they are not liable to the housing levy. So, for example, also this shift, some of the incomes are just one of like the bonuses. Do you also subject them to shift?
Can I ask another question?
Yes.
Okay, I have another question from Mr. Soro.
Yes.
On my side, I created the employer's portal before, but I've just realized that you are supposed to migrate from NHIF to SHA, whereby you are supposed to click on e-citizen to migrate from NHIF to SHA. But on my side, I created as if I'm created for a new organization. The other one, in the portal, in the new portal, I've seen that you can be able to add the new stuff, but there's no that amendment that you can be able to, once the staff exists, the organization, you can be able to remove that stuff. Then another question, are we supposed, for now, for registration of the employees, are we supposed to upload it from now, but on the column of the NHIF contribution, are we supposed to put any amount, or what are we supposed to, I start to be guided on that? Thank you.
Morning, I have a question. My name is Priscilla. This is, yes, a question for Mr. Osoro. So I've heard him mention about the admin details, so maybe I'll get to him because we need to replace someone who's exited, because I've not yet updated the details, though we are already registered. The other one is on an individual who has registered and indicated as self-employed, has now been registered and is required to make a payment, but at the same time, this is an employee whom we're going to be deducting through the employer, through the payroll. So how do we rectify that so that that employee is not deducted twice, as a self-employed and under the employment of this organization? Thank you.
Allow me to respond to those. One, a number of companies, initially or entities, before training, proceeded to register themselves as new employers, while they were former members of the defunct NHIF. I did indicate we have quite a number of state agencies that did that mistake, but we have told the system developer to provide for what I call a system update, whereby you'll be able to link your NHIF details with the new registration. So it is something we are working on, and immediately it is done, we will issue a statement to your respective professional bodies. Now, for staff who are exiting, including retirees, you will deduct until the month they retire. The following month, you'll remove them from the payroll and the byproduct, so their contributions will not appear there. Remember, the payroll is a monthly thing you do, and you keep appraising it depending on the circumstances on the ground. Once Mr. Osoro retires, I'll be exited through the payroll. In the last month, I'll be paid, I'll appear. The following month, my name will not appear, so you'll not make any returns. I hope I'm very clear. Same case to those people who are joining. In this month, we could be recruiting new employees. As they come in, once they earn their salary, you will deduct and remit. That is, increase on the payroll. The other thing is persons who are self-employed, and in this instance, I want to believe they made prepayments, that they paid upfront. Now, we have a quagmire there because the law is very clear that all persons engaged in gainful employment will contribute 2.75% of the gross salary. You will proceed and deduct as we look at mechanisms, because the law as established does not provide for refunds, but it's a matter that has been raised in the past. We are trying to adjudicate over it and will advise in the fullness of time the best way forward. But for purposes of persons in employment, it is a requirement to deduct. Thank you.
Thank you, Mr. Osoro. Just a clarification. The person who has registered as a self-employed individual has not made the payment. So they've been prompted to make payment, but they did not. So that's where it is at. So I don't know what happens from there, because the person doesn't want to make the payment, because we will start making the remittance as an employer. So I don't know how the system...
I get you very clear. So tell him not to remit, as you've properly said.
Yes.
At the point of making remittances, the system architecture is such as an inbuilt AI. It will notice that this person who one time registered as self-employed is now engaged in gainful employment. It will auto-update. So wait until you make your monthly payroll returns. The system will automatically auto-update. I hope I'm very clear.
Yeah, that's clear now. Thank you very much.
Welcome.
Another question?
Yes.
I have a question in regards to the people who are in NHIF previously, and we received a communication that they were automatically catered for in SHA without registering. Can you affirm and reaffirm that that one is in order, or it will come a time that one of our staff has not been registered? And then another thing, are we using the same numbers that were used in NHIF in SHA?
Thank you for those two questions.
Whilst you're on that, Mr. Osoro, allow me. I registered my parent, whom I was the custodian of their NHIF, but the system refused to pick up my number, which was the number that had been in there when we were using the NHIF. Now, coordinating with them from wherever they are, for me to be able to execute the other, maybe even the payment, it's been very difficult because the OTP is being sent to the number in the village. Yet I am not in the village. I've been trying to change that number, but it refuses. I don't know how that can be assisted. Then number two, my concern is also on a lot of unanswered questions on the employment side, like the things that needs to be clarified, like the expatriate. Yet this particular shift, we are supposed to be implementing it by the end of the month. I don't know now where we stand in terms of implementation when the system is not fully operational on all the things that we need to be uploaded there. Thank you.
Allow me to
a follow on the same, just a quick one. Now, for the people who are automatically registered and the ones who registered themselves, how are we going to reconcile the numbers? Is the new identifier the number that we have gotten from personal registration, or even the ones who are automatically registered were given numbers? And how do we reconcile those numbers?
Thank you. Allow me to respond to the issue.
Sorry, just one last one. Mine was also automatically moved, but I'm not even able to add my dependent, like for example, my child. No, I don't know where we are with that one.
Okay, a follow-up on the same. So if I was moved to SHA and I lost my phone, so I'm not able to access the number that was shared to me. So how can I be able to still know whether I am registered or I'm not registered? And does it mean that if I was moved to SHA, then it means that I also don't need to register?
Allow me to say something on the issue of the data that was the transition from the defunct NHIF to SHA. Now, there was a legal gazette notice number 147 of 2024 that was issued on 19th of September. The legal gazette notice amended section 13 of the Chief Act, which said that the former members of NHIF were supposed to register fresh. In the gazette notice, it expressly stated that the members of the former NHIF were to be transitioned to SHA after verification by other state agencies. I wish to confirm that 12 million records were submitted to the National Registration Bureau, which is the single source of truth. Of the 12 million, 9.2 million records met the threshold and were transitioned to SHA. What SHA did, they issued a notice informing the former members of NHIF of their successful validation of the information. The message went further to advise the members to proceed and update their details. I want you to underline the word proceed and update the details. So I want you to tell your members, despite receiving the text messages, that it is imperative upon themselves to proceed and update their details, including updating details of their dependents, their spouse, and the children arising out of that particular marriage. I want to be very clear. The other thing I want to say is the unique identifier. I've had 3 questions of what is the unique identifier, the primary identification key, and the Social Health Insurance Fund. For purposes of this meeting, the unique identifier is your national ID that has never changed since time immemorial. The NHIF number itawekwa kwa kaburi ya sahau, but your ID will be there. So I hope I'm very clear that the unique identifier, you'll see many other numbers. You'll get a SHA registration number and others, but the unique identification key will be the national ID. On the issue of adding dependents, remember we have 2 portals. We have the SHA portals and afyayangu.go.ke. Now, from the baseline survey we've done, it is easier to add your dependents, that is your spouse and children, using the afyayangu.go.ke portal, whereby you need to scan a copy of the birth certificate, the marriage certificate, or affidavit and proceed to onboard. On the issue of the lost phone, I wanted a clarification. Are you still intending to maintain that particular number, or you've discarded it? If it is discarded, then you need to make a fresh application with the new cell phone details to be updated. But if you intend to renew the SIM card and proceed to use it, there is no use, because messages will continue coming to your cell phone as was in the past. On the issue of system preparedness, I want to confirm that indeed the system is prepared. There could be a few issues here and there, but we are working overdrive to address those issues, including those expatriates. I did tell you that last week we were doing what in ICT is known as a test environment, trying to see whether we can capture the expatriates, the refugees, aliens, amongst others. And we will be able to issue a statement through your body to update you that the system is working seamlessly once it meets the threshold. The issue of parents whereby the system has refused to change the phone number, the current phone number, we are acutely aware of that. The system developer has been requested to issue amendment rights to our officers or to the principal member to provide for amendment of the cell phone number, so that for the people who registered with cell phone numbers that are defunct, they can update them to the current number. I want to rest it there. I know we are pressed of time. We have about 14 minutes. I don't know through the chair whether we can take some. I know there are questions for benefits and the legal team.
Thank you, members.
I have a question.
Yes.
We used to have contact persons in at NHIF.
Yes.
Are they the same people or there are some changes?
Thank you. They are the same people. What we want to do, and it's good you've asked that particular question, we want to assign liaison persons, especially you people in Nairobi. That's why I said you do a message to my inbox. I'll be able to give you a contact person who will walk you around these particular screens and assist you either register or do an upload or answer issues relating to registration. We have made provision for that. So kindly proceed and draft a message to my inbox and we'll be able to address it. Welcome.
Osoro, let me ask you one question briefly.
Yes.
For the members that received, that were transferred from NHIF to SHA and were advised to further proceed and update their details. If a member fails, if an employee fails to update their detail, as an employer, how does it affect you? And when filing the byproduct, does it affect you in any way? Or is there anything that an employer should do to help the members that failed to go ahead and update their details?
Thank you. That's a very important question. On the issue of remittances, you'll proceed to deduct and remit. The record for the remittances will be within SHA. Now, at the point of seeking services, this employee who has not updated records, because they're already members of SHA, but what they've not done is to update their records. They can proceed to update services and access healthcare services. Of particular importance, I want you to take home that services are tied to members' contributions. So failure to deduct may have fatal consequences for the member. But it's better you deduct and the member creates time later on to update records, because we have people in NHIF, the previous NHIF, whereby the employer has deducted, but the principal member never registered. At the point of registration, the system has an AI inbuilt capacity. It will be able to pull that particular data and update the new registration number. I hope I'm very clear. Thank you.
Right, Mr. Osoro.
Yes.
Probably I can go next. I'm trying to look into the Social Health Insurance Act, and I'm not seeing it's explicitly saying the 2.75 deduction. Probably you can clarify where that percentage came from, please. I stand to be corrected once again.
Archibald, if you're on board, you can cite the particular section. It is both in the Act and regulation, but let our colleague from legal proceed and answer that.
Yes, please.
Yes. Give me a moment to just project that provision. It's in the regulations, but you're correct, Mr. Osoro, it's in the regulations. Then just give me a moment to project.
Please project.
I will, through the chair, request that we share with you both the Act, the regulations, and the user guide so that for ease of reference as you retire from the meeting. Thank you.
Okay, as we are waiting for that, I was inquiring about the Gazette notice which was passed on. It is mostly talking about services for shift being in level 4, 5, and 6. I was wondering where the private hospitals are leveled and what are the documented benefits being expected from the private hospitals. And then currently we are being made by the private hospitals to pay for gross bills. What is being done towards that so that we all benefit at that level? Thank you.
Thank you. I hear you loud and clear. The question is under SHIF, does SHIF empanel private healthcare providers? I want to confirm that indeed, Social Health Authority has contracted the following cadre of facilities. One, we have government facilities. And when we talk of government, we have both the national government in level 6, teaching and referral hospitals, and other county facilities from level 2 up to 5. The other facilities that SHA empanels are faith-based institutions and across all CAF levels, from level 2 up to level 5. The last cadre is private healthcare providers. Now, what I want to say is that SHIF did roll out the contracting process. It was willing buyer and willing seller, whereby private healthcare providers had on their own motion to subscribe to the contracts that were rolled out by SHA. And I want to report that the majority of them have returned the contracts. There are few that are works in progress. So it is an ongoing process. There's also the process of getting their credentials on the SHA portal that has been ongoing, and majority of them are currently onboarded on the SHA healthcare providers portal. So that is works in progress. I want to rest it there. And we can, yes?
Okay, maybe on the same issue about the contracts you are signing with the private healthcare service providers. Are we still going to be expected to receive the captioned amounts as specified for the level 4, 5, 6, or it's going to be at different levels? Thank you.
Okay, there's someone.
Someone is on phone, please mute.
Now, in the spirit of UHC, when we talk of universal health coverage, we are talking in equity in terms of contribution payment and equity in access. Under the new dispensation, all facilities will access one benefit package, which is the essential benefit package under SHA. The payments, that is the tariffs that were subjected through Accurate simulations after a baseline survey, cuts across board. So when we talk of paying for an MRI at Kenyatta National Hospital and a private provider, the reimbursement rate will be the same. As SHIF, we say that all children are created equal in the eyes of the Lord. So reimbursement will be standardized across board. It is now you to decide where to go. I hope I'm very clear on that.
I have a question. This contribution per household.
Yes.
If members are employed, does it mean one is exempt, or if one person is employed and the other one is in business, who pays? Is it the employed person or what? Because it's per household, not per individual. Please clarify that one.
I'll clarify that, and thank you for that very particular question. I want to go back to the definition of a household. The household, as defined by the Act, includes the principal member, the spouse and children, biological children arising out of that marriage or adopted children, of course, through guardianship and others. Now, when we talk of household income, we are talking of income, be it for the principal member and the spouse. And to give myself as a case, I work for SHA, and from end of this month, I'll contribute 2.75% of my gross salary or wage. Same case to my spouse, who's working also for the national government. She will also be deducted 2.75% of her income. Then will be subjected to 2.75%. The question we should answer, me and my spouse both earn income, so that income will be subjected to 2.75%. We have, I think, 3 minutes before we
Mr.
conclude.
Osoro?
Yes.
Mr. Osoro, I just because someone was asked about where to find the 2.75%. I've just projected, I hope everyone can see on the screen, it is Regulation 17, deals with the salary deployment, pay 2.75% of the monthly income. And then for the non-salaried, that is the self-employed, it is Regulation 18, that says 2.75% of the annual contribution. So that's why you'll find it in the regulations.
Thank you. So it's clear now.
Hello, Archibald. Just to confirm on that part, 17 subsection 2, that says the minimum contribution is 300. What about for casual worker whose income is not, the 2.75 will not, let's say, amount to 300? Will she take that as monthly contribution, or should we deduct 3,000 for that week, let's say he worked?
Okay. So if I got your question correctly, you're referring to those who are receiving wages, but they're not being paid monthly. Is that correct?
Yes.
Thank you. Okay, so I don't have a good answer for you now, because that is something that will be dealt with administratively, because the Act has only given provisions for how to calculate, and the calculation is done monthly. So the only answer I can give you is that for SHA, they will need to advise employers on how that weekly wage can be translated into monthly, so that the 2.75 can be deducted appropriately. Because currently the regulations don't deal with anything lower than a monthly deduction, and it must be done on the 9th of each month. So I know it's not a complete answer, but it's the situation.
I have a problem with this SHA is just the benefits are outrageous compared to how much a household is supposed to contribute. Because if the two spouses are supposed to contribute 2.75 each from wherever they're getting their income from, and the kind of benefits being given, it's funny. I don't know how long it will take for you people to reconsider or reevaluate the benefits, because if you give that kind of benefit, it's very discouraging.
As an add-on to whatever my colleague has said, I was just taking a practical example. Assuming we have two spouses, each earning 250,000 a month, that's a gross salary, then it means that person is contributing 6,875 per month. So annually, each of them is contributing 82,500 shillings annually. And then on the benefit side, we're looking at, say, for example, I am a young woman of productive age. I am bound to get pregnant, maybe every once in 3 years. Then you give me a benefit of 10,000 shillings. In your opinion, do you think that is fair? That is number one. And then number two, then assuming we even go for cesarean section, for example, it is 30,000. Is it commensurate to 160, almost 165,000 annually per person or per household that you put it? Because it's not individual. We are both contributing to it.
My concern is with the upcoming holidays. as the practice has been in Kenya, there'll be increase in accidents, unfortunately for us. However, with the current system in place, we are regulated, or correct me if I'm wrong, we are controlled to the facilities within our localities that we chose. Now, assuming I travel across the country and, God forbid, happen to be involved in an accident, will I still get services from wherever it is that I will be, or from wherever the accident will have taken place? And two, you had talked of emergency care being provided only within the first 24 hours. What happens for the rest of the period that I will still be on treatment? Number three, what about the children who are across the country? I may have chosen a hospital or a facility within a certain location in Kenya, but my child or my better half or whoever else is in my cover is across the country. So what happens to them?
Thank you. Allow me to respond very fast because it's already 12. I'll start with the first issue that you raised on portability of services, that you've traveled outside your primary care network. You've gone to another jurisdiction, another county, and unfortunately, you are involved in a road traffic accident. So the first thing, as my brother Joseph Otieno indicated, Section 43, Article 2 of the Constitution says that every Kenyan has a right to emergency treatment. And to activate that particular clause, SHA is obligated to ensure that, one, you get emergency services at the point of the accident, whereby you'll be stabilized. You will be able to get emergency road evacuation services, whereby the ambulance personnel will stabilize you, transfer and transport you to the nearest empaneled and contracted healthcare provider. Now, I want to clarify something on emergency. The emergency services applies to all Kenyans, irrespective of the membership status. As I indicated, it is activation of Article 43, Sub-Article 2, the right to emergency care. But for members of SHA, they will continue accessing services after the lapse of 24 hours until and when you are fit to go home. And you will be taken to a facility, specialty services based on the nature of treatment that you require. Now, to go back to the issue of portability of outpatient, because outpatient services is whereby you are required to select a preferred primary care network of choice based on convenience where you live. I live in Nairobi currently, but in event I travel, go home to Western and fall sick, then you liaise with the nearest SHA offices to advise you on the nearest facility you'll go, or you'll call the toll-free line. We have a 24 toll-free line whereby they can be able to advise you based on the service level agreements that providers have there. So I want to rest it there. I don't know whether there are any further questions because we are out of time, and hand over to our session chair. We promise to share the following because some of the questions we are raising are available in the frequently asked questions that have been developed by SHA. We'll request Oscar to share both the regulations, the act, the benefit package, the employer portal guidelines, and the FAQs immediately we are done with this presentation. Otherwise, from my end, I want to say thank you for listening to us. We are available. You'll never walk alone. Please, in the event of any challenge, you can do an email, WhatsApp, we'll be able to respond. Thank you and have a blessed noon. Over to you, Oscar.
Thank you, Bwana Osoro. Now, members, Bwana Otieno went into another meeting, but he has answered most of your questions on the wall. So go through and see the answers he has provided. As we come to the end, I want to thank all of you.
Maybe my sincere apology. There is a question we've been raising my hand. Now, in this template, we still have the NHIF code, employee code and the SHA. Which one are we going to use?
We still have, come again?
On the Excel.
We have the. Are you live on the screen?
NHIF employee number.
We have the payroll number, first name, last name, ID, KRA PIN, gross salary, contribution amount, and phone. And I've said gross salary was removed.
Kindly please read that
The
phone number again.
NHIF number is still there.
Okay, that one is
The NHIF number. Are we still using the NHIF number or the SHA ID?
actually the SHA ID is the national ID number, which is supposed to be there. We will issue a clarification shortly because what we anticipate to have, the primary identification key is the national ID. In fact, if you fail to indicate the ID, your contribution may not be acknowledged. So you can put in the NHIF number as an option, but it is not mandatory. What is key is the national ID number. And I'll be able to tell the developer, for purposes of clarity, we need to get rid of that NHIF ID, NHIF number, so that not to create confusion. Are we clear?
And at the same time,
Mr.
So
Soros number, please.
for now, we simply wait for the new updates.
Yes, it is being updated by
Mr.
this
Soros number, please.
0724
0724
409619.
4096.
But you can also inbox me. My email is gosoro at nhif.or.ke.
So, Mr. Osoro, let me ask a question.
Mm.
On the SHA, when we are uploading the SHA, is it a must that all the fields, that is the name, the number, the phone number, is it a must that all of them?
Yes, because remember, these people you are remitting contributions to, we will be communicating to them periodically. When they're asking for services, they need pre-authorization. So we need to have an accurate number to enable us communicate effectively.
Can we get the same from you, because you guys already have our data?
We have a very democratic institution. We gave you a chance to validate your own records. That is why we say, after transitioning the data, we give you a chance to look at what we have, confirm it is correct to the best of your knowledge, and confirm the same by submitting it. So the person who knows the correct cell phone number is you yourself and the employees. We may not have as one of us has indicated, some of these cell phone numbers have been overtaken with time. It is a good opportunity to update. Thank you. Over to you, Oscar.
So maybe I can give a suggestion.
Yes.
Maybe when you go back, you can just send us the amended table.
Okay.
So that you remove anything that we don't need.
All right.
Yes.
We will be able to communicate back and share with you the updates.
Excuse me, Oscar.
Yes, sir.
Oscar, you've shared your number.
Oscar or Osoro, I've not shared my number.
Oscar, share. Oscar, share. I'm addressing Oscar, please.
Okay.
Oscar.
Yes.
Oscar, you shared your number. Kindly pick up your call when we call.
Okay.
It's been a practice. People share their numbers, but when we call for assistance, they don't pick up calls. Kindly pick up our calls.
Okay. So thank you very much, participants. We've come to the end.
Will these presentations be shared? Kindly clarify.
Yes, they will. They will be shared. I'm getting to that. So as we close, kindly receive my CEO's apologies. He's been held up in a meeting. He's not able to address you. We encourage you to also allow your other professionals in the office to join the subsequent meetings. Our meeting is coming up on 17th, 22nd, 24th, and possibly 31st. So let them also share. I let them join and participate to gain this knowledge. The presentations will be shared, and any other information you require, as Mr. Archie had indicated, but we'll do this through IHRM because for us, it's the easiest way to do that. So let me also take this opportunity to thank all of you once more for registering and participating, to thank IHRM for coordinating your participation, MOH, whom we are also working in partnership, the presenters from SHA, Bwana Osoro, Bwana Nyarango, and Mr. Otieno for their presentations, which I have said we will share. As we proceed with the other webinars, there will be no harm joining again because learning is continuous. And please encourage your other professionals who may not have joined today to join. And when they're doing that, next time, let them join early because you can see the number is only 500. Should we get to that, then they may be locked out. Otherwise, thank you very much and may you be blessed. Will someone close for us with a word of prayer, please? We started with a prayer.
Maybe before we close, I think the number is capped at 500. What if we move to other meeting webinars like the Teams that can accommodate maybe up to 1,000 for quite a number of people who are locked out? This will also ensure that majority are trained and there'll be no back and forth on these similar services that are intended. Thank you.
Yes, that is taken care of. We will liaise with our partner IHRM so that we can move to a platform that can accommodate as many people as possible. Thank you for your comments. Remember, the PS Medical Services is part of this team, and all your concerns will effectively reach it through this platform. And it has also been recorded. So someone to volunteer to pray for us, and may you be blessed wherever you are.
Can I close with a word of prayer?
Please do, Wilfred.
Before I close, I appreciate the session, but Mr. Head of HR, next time we need some female energy in this session. You've said a word of thank you to the misters and the bwanas. However, we want more female representation. With that, kindly members, let's close with a word of prayer. Everlasting Father, we come before you at this hour with thanksgiving in our hearts. We began the session with a word of prayer, just asking you to lead us through the moment and the session. Father, you've been faithful. We've learned a lot. We've taken quite a number of notes, but Father, we pray for a better Kenya. We pray for better systems. We pray for better processes. Father, we ask that as we leave this session, each and every one of us will be guided by you. Above everything, that the Holy Spirit be present in us all. We thank you and lead us through the rest of the day. In Jesus' name we pray. Amen.
Amen. As you go, please watch out for the registration link for the CPT points. And this recording was live on YouTube. You can reach out for it. Thank you and bye-bye.
Thank you, bro. It was a heavy one.
Thank you.
For registration.
Sorry?
Registration for HRM for CPD.
There is a link. Watch out for that link.
The link is in the chat.
Yes. Okay. And then for the video, it's on YouTube.
And I don't know. Let me see. I'm not on.
Yeah.